Hi, this is Project Empathy. Today, we shall talk about elderly depression. It's the most common mental health issue, not just in elderly, but in the general population too. Let's address a few common misconceptions about depression in general before we dive into the topic of elderly depression. Many may think that depression is just about feeling sad, as often depicted in the media. Picture someone in tears, crying over a breakup with a good-for-nothing boyfriend. That's what many people may think is depression. While it is true that feeling sad is a common symptom, it is not the only symptom. Your body is so interconnected that symptoms of depression manifest in many different ways. This includes appetite changes, changes in sleep, substance abuse, and loss of interest in activities once thought to be enjoyable. This is important as there are many signs of depression that are easy to miss, partly due to this misconception. Many may also think that depression is a sign of weakness. Somebody who's unable to handle it must be weak, right? This is especially untrue. Depression can happen in the strongest and the best of us. Think the famous wrestler and actor Dwayne "The Rock" Johnson, Olympic legend Michael Phelps, and the beloved Johnny Depp. All of these people have depression. Depression is not a sign of weakness, but mocking those with it is. Now, let's talk about elderly depression. What are the common causes of elderly depression? In truth, there are many different causes of elderly depression. However, the main four are poor physical health, dealing with loss, loneliness and social isolation, and last but not least, poverty. In old age, individuals become at higher risk of physical health conditions and chronic illnesses. Hypertension, for instance, is more common in elderly as their blood vessels become stiffer with age, increasing blood pressure. Thus, many seniors are diagnosed with chronic illnesses in old age, which can be devastating or hard to accept. It can also cause them to feel worthless or like a burden to loved ones and friends, which leads to depression. Also, in old age, seniors typically deal with much loss. This is especially since many of those they are close to are also around the same age as them. This includes their friends, their siblings, and most importantly, their partner. Having to deal with a lot of loss is something that's inevitable and brings great grief to them, which they may be unable to handle and thus crack. This also contributes to the loneliness of the elderly, with less people by their side. This brings us to the next factor, which is social isolation and loneliness. Singapore has many elderly living alone or feeling lonely. According to a 2021 Duke NUS study, 9% of Singaporeans aged 65 and older live alone, while 34% perceive themselves to be lonely. Loneliness is feeling that one is too inadequate to connect with others or that nobody really knows or cares about them. These feelings, while experienced by most if not all occasionally, if prolonged, is a significant cause of depression. Last but not least, poverty is another big cause for elderly depression in Singapore. While Singapore is a rich country, there are many who live in poverty, a large proportion of whom are elderly. According to the Bogan Project, poverty amongst the elderly population increased by around 74.3% from 2012 to 2015, more than a national increase of around 43.5%. This is often due to the lack of financial support from family, coupled with retirement and possibly poor financial planning. They are also less attractive as potential employees due to their age and outdated skill sets, thus often having to take up low-paying odd jobs to pay the bills. With poor living conditions and exhausting nature of the job, they have a greater risk for depression. Now, what are the common symptoms associated with elderly depression? Elderly depression can manifest itself in many ways. A common one is the loss of interest, motivation, or energy in activities once thought to be enjoyable or something that the individual does regularly. This is linked to appetite changes, when an individual feels unmotivated or uninterested to eat even their favorite dishes. It's also linked to changes in personal hygiene due to no motivation to shower or even brush their teeth, and social isolation with no interest to interact with others. Another common one is unexplained physical symptoms, such as limb pain, joint pain, or gastrointestinal issues. This is because there are neurotransmitters associated with both pain and mood, the two main ones being serotonin and norepinephrine. Those with depression have low levels of these two neurotransmitters, which leads to feeling more pain, hence the physical symptoms. Last but not least is the commonly associated depressive mood for more than 2 weeks, or feelings of guilt, helplessness, or despair. Take note that in depression, these feelings are not temporary and last for quite some time, i.e. 2 weeks or more. It's perfectly normal to feel such feelings once in a while, especially after a traumatic or sad event. Interestingly, depression, according to Dr. Ronald D. Elderman, often manifests differently in older adults. Rather than a depressive mood, a lack of interest or energy and physical symptoms are more common in the elderly. This makes elderly depression particularly difficult to diagnose, as these symptoms are often associated with physical problems or old age. Thus, family members and even medical professionals miss these signs, testament to the difficulty of overcoming this issue. So, how to treat depression? Depression is a treatable condition and ideally should be treated with a combination of 1. Medical and psychiatric treatment and therapy, as well as 2. Lifestyle changes. Medical and psychiatric treatment and therapy is essential in treating depression. This is because medical professionals have experience, expertise, and training to handle the issue well, which most others lack. Lifestyle changes or engaging healthy habits or activities regularly is a great way to supplement medical treatment as they improve mood, sharpen cognitive skill, and strengthen bonds between others, thus helping with depression. However, it is by no way a substitute for medical and psychiatric treatment, which in most, if not all cases, is necessary to treat depression. Some examples include engaging in activities that provide cognitive stimulation, physical exercise, and taking care of a pet. I will elaborate more on this in a later video, given the already long duration of this video. All in all, depression is a common but severe illness that plagues our old age population. Even with medical and psychiatric treatment, as well as lifestyle changes, people around them also play a part in helping them overcome this monster of an illness. We need to support those with it, practicing patience and empathy towards them. We should never judge them or mock them. This not only applies to seniors, but ultimately also to everyone else too. Thank you for watching. Once again, this is Project Empati. You can support our mission by liking, sharing, and subscribing, or spreading the word to others. You can also do so by checking our other videos. Goodbye.